Doctor accidentally severs man's penis during enlargement surgery. Yeah, so I came across this article a few days ago. Definitely caught my attention. The other crazy thing about this article is that apparently this happened in South Korea, and I feel like this really isn't helping the whole Asian small penis stereotype, bruh. But I feel like they always say, stereotypes typically do have some type of, I guess, underlying truth. But yeah, crazy, man. So I mean, I've heard of penis enlargement surgery before, but of course, I didn't know. I don't know what exactly it entails. But I did a quick little Google search. So apparently, okay, so penis enlargement surgery or phalloplasty, I'm pretty sure I'm messing that up, involves procedures to increase penis length. So I guess there's two reasons why people want penis surgery. One, I guess either for a longer penis or two, for a girthier penis, or somebody could want both if they're really lacking, bruh. So for a longer penis, the surgery pretty much, I guess, includes the cutting of the suspensory ligament, which sounds very painful, bruh, and that gives you a more flaccid hang. So I'm guessing on gummy, you're gonna see a longer piece. I'm guessing is what they're saying, bruh. Or girth, I guess you use a fat grafting or whatever that is, or fillers or implants. I guess they call the implant a pneuma. I'm not gonna lie, I can't imagine having a rod in my rod, bro. Like, I'm pretty sure you can feel that. You know what I'm saying? Because like the penis is a very sensitive area, bro. Having a rod in it, I feel like you'll be able to tell. I wonder what it's made out of, the actual implant. So I guess these are some more common procedures. That's the suspensory ligament. Fat grafting. What is fat grafting exactly? Fat is taken from another part of the body. Oh, like the abdomen, and injected into the penis shaft. So they take fat from another part of your body and inject it into your penis. That sounds crazy, bro. Results can be temporary as the body reabsorbs fat. So the fat grafting sounds pretty much trash. I'm pretty sure all of this has crazy side effects, bro. Silicone implants? Nah, I don't want. Isn't silicone plastic? I don't want plastic in my penis, bro. A soft silicone implant is surgically placed under the skin for permanent girth enhancement. So that's permanent. I wonder if it's FDA cleared for cosmetic use, but carries risk like scarring. We talked about the FDA in the last video, bro. Like, the FDA is trash. Like I said in the last video, I'm pretty sure the FDA does allow beaver butt juice to be in our food, bro. You can check my last video. Like, no cap, the FDA allows the secretion from a beaver's anal glands to be put into our food, bro. No cap, no joke. That's real. Check the last video, bro. So yeah, what are some of the risks? Complications can include scarring, of course, deformity, bro, erectile dysfunction, and loss of sensation. I'm not gonna lie, I feel like the cons don't outweigh. I feel like the pros don't outweigh some of these cons, bro. Like scarring, deformity, erectile dysfunction, just so you can maybe get a bigger penis temporarily. I don't know, man. Like, I've never thought of penis surgery, enlargement surgery, and I'm not saying I have the biggest penis, because I don't. But I guess if you are in a situation where like you're like really lacking in that department, like, yeah, I guess, I don't know. I'm trying to put myself in that position. Like, if I was on some micro penis type stuff, like, would I think about? Nah, I don't think I would, man. I don't think I feel like this just seems very intrusive, invasive, the surgery, bruh. I feel like they have natural stuff out there, like herbs. I'm pretty sure I can find like an old African remedy to get a bigger penis, bruh. Yeah, I don't think I would go the surgery route, but yeah, we're gonna check out this article, man, because that's crazy, bro. Like, you're literally going in to get a bigger penis. You're walking in with the mindset to get a bigger penis, and then you walk out with no penis at all, bro. Crazy, bro. If you guys are enjoying the content, please like, comment, subscribe, all the good stuff. I would highly appreciate it, but let's get into this article. Again, doctor accidentally severs man's penis during enlargement surgery. A doctor performing a penis enlargement surgery on a fella in South Korea is said to have produced the opposite of the desired effect by severing his todger. Again, I think Daily Star is like a UK thing. It is because it says it in the address up there. So todger, I'm guessing, is UK slang for penis, maybe. Crazy, bruh. This surgery did not go to plan at all. You don't say. A doctor accidentally severed a man's willy during penis enlargement surgery. The patient, 35, attended a surgery procedure in the Gangnam style? Not Gangnam district of southern Seoul, South Korea in 2020. Okay, so this is a few years old. So he was only 35, bruh. I mean, no, I feel like, yeah, you've been living with a small one for 35 years. I feel like that is a long time for you to contemplate, whether or not you want to get enlargement surgery, bro. I wonder how big his penis actually was, bro, like in terms of length and girth, no diddy. I'm genuinely curious, like I wonder what's the average size. What's like the average size for a penis for like where men will really think about surgery? You know what I'm saying? The surgery went badly wrong, and the man's mutilated member was severed horizontally. Wait, what does that mean? Wait, it was severed horizontally. Oh, no. Yeah, this is horizontal. This is horizontal. This is vertical. Yeah, so it was pretty much severed at the base, son? Oh, my man walked out with you can't even say he walked out with a vagina because at least the vagina is a hole. He just walked out like a Barbie doll. You ever seen a Barbie doll naked? I'm pretty sure all you guys have. Yeah, it's just or a Ken doll, if you're into that too. But yeah, it's got that rounded kind of undercarriage part. My man was walking around with a Mattel Barbie body, bruh. He was left with severe physical and psychological trauma, I bet, as well as a loss of sexual function and trouble urinating, bro. But I feel like they do have reattachment surgery out there, bro, because I don't know if you guys remember that. I think it was a story in the 90s about some lady cutting off her husband's penis for whatever reason. Lorena Bobbitt, I think it was the lady's name. You guys look this up, but I'm pretty sure she cut off her husband's penis with scissors. He must have cheated, bro. I'm gonna look up that story later, but I'm pretty sure he cheated now that I'm thinking about the story. But yeah, I think she cut off his penis. And then they found it like in the front yard, I guess, police and whatever. And I think he had his reattached. And then I think he became a corn star, bruh. No joke. Like I said, a man with a severed penis, well, with a reattached penis, I think he became a corn star, bruh. Lorena Bobbitt. Look up the story, bro. I don't think I'm capping. Where we at? That's crazy, though. He can't have sex anymore, bruh. The urologist who performed the procedure was ordered by a court in January 2024 to pay the equivalent of around 1,300. About 1,300 euros. I'm sorry, 1,300. I'm slow as hell. 13,000 euros. How much is that in dollars? Let me know in the comments, smart people. In damages. However, the physician has appealed this ruling. I ain't gonna lie, man. 13K for taking off my piece? Nah, son, I need more than that, bro. I feel like I need more than 13, bro. You take off my piece, my manhood, my lineage. I can't yeah, 13K for a severed penis. Nah, son, we need more than that, Brody. And the physician appealed this. He not even trying to pay, bro. Earlier this month, the doc was also fined by a Seoul. I feel like I'm pronouncing this wrong. Court. For causing injury through professional negligence and slapped with a $3,600 fine. Again, bro, I feel like these are all low numbers. I wonder how so they said he was professionally negligent. I wonder like what exactly happened. Like, how do you accidentally cut off a penis during surgery? I mean, no, that's probably a stupid question because I mean, you literally probably have a blade or some type of cutting tool while you're handling a penis, so yeah, of course it can happen. That was a stupid question. The patient had previously undergone 2 surgeries on his penis. This is his 3rd penis surgery, bro. Like, no, okay, wait a minute. Is this his 3rd enlargement surgery? And the artificial implant installed had fused with the spongy erectile part. Okay, so he had an implant previously, bro. And that implant fused with the spongy erectile part of the male appendage known as the corpus cavernosum. I feel like we're messing that up. Oh, bro, 3 penis surgeries is kind of crazy. This process, known as an adhesion, can occur following a surgery and lead to issues like erectile dysfunction, but the doc failed to inform the patient that this was the case. Oh, the doctor didn't tell the patient about some of the certain risks that come with the surgery. Oh yeah, he's definitely getting sued for sure. But much more money than that, bruh. I need more than that. During the procedure, the dodgy doc cut through all of the corpus. Oh my goodness, cavernosum, in all but 5% of the corpus spongiosum, the mass of the tissue surrounding the urethra. Oh my goodness, this sounds crazy. Severe damage to the penis and the urethra was caused. My lord. In a case with serious adhesion, the dissection should have been halted before causing injury. And suturing, oh my God, suturing is crazy, should have been considered to prevent complications. You can suture, that's like pretty much welding on a penis, bro. Attempting dissection despite poor visibility of the penile anatomy led to the injury. My lord, I feel so sorry for this man, bro. During the trial, the doctor denied not properly informing the patient of the full risk. So he's saying that he did tell Buddy about the risk. He also said it was not foreseeable that the procedure would lead to damage to the urethra, but the court found it violated his duty of care and the duty to inform. There is a possibility that the patient would have refused the surgery had the risk been properly explained, the court said. Yeah, bruh. Yeah, I mean, I think we read some of the risks, bro. Like, yeah, scarring, deformity, erectile dysfunction. But low key, I ain't gonna lie. I feel like, is that the end of the article? I ain't gonna lie. I feel like if you're gonna do something like penis surgery, I feel like that's something that you should fully research before you go into that fully. You know what I'm saying? So I'm gonna say this guy has a decent head on his shoulders. I'm pretty sure he researched penis enlargement surgery and like the risk that can come along with it. So I'm pretty sure Buddy knew about the risk. I'm just gonna say that right there, because I don't think you go into penis surgery, like something that serious, without fully researching it. So I'm thinking he's just saying that to, get his money or whatever in court, which I don't blame him, bro. If you cut off my penis, if you cut off my thing, yeah, I need money, bro. I need all that. Because it sounds like they can't even reattach it, bro. Which is crazy, because again, like I said, in the 90s, I feel like I have heard about the reattachment story. And the fact that guy went into corn. Matter of fact, I might do a video on Lorena Bobbitt, bro. Because I feel like that story sounds crazy. For real. If you guys stuck around for the whole thing, I appreciate it. Again, if you guys are enjoying this type of content, please like, comment, subscribe, all that good stuff. I will highly appreciate it. Probably gonna hop on Arc Raiders in a minute. You guys enjoy the weekend. If I don't see you, if I don't see you during the weekend, you guys enjoy the weekend. Peace.